not only is salicylic acid the least inflammatory, it's actually anti-inflammatory. And the peel that you're about to do is my favorite peel for rosacea. It's the Theraplex peel. It is a proprietary salicylic acid peel. It's very predictable. It is extremely well tolerated by patients. And one of the additional benefits when you're doing combination treatments is if you do the salicylic acid Theraplex peel first, you actually get an anesthetic effect to the skin. It makes the subsequent injectable much better tolerated. Not that any of these things aren't well tolerated.
Now there is a little burning and stinging quality. Always have your patient close their eyes. You don't want to inadvertently get a drop of peel solution in. I like to start on a broad area, and I'm going to start on the area of the cheek. Don't have it drippy. Have your little adapter, whether it's a cotton tip applicator, damp with a good quantity, and make a broad stroke to the unit area you're going to peel. You can see I'm stroking it directly first over the cheek. Here I'm going to stretch the skin, bring it down to the chin. Vertically I'll go to the chin. I go right to the vermilion line as I cover the chin. And I'm going to cover the face first before I go to the neck, taking each unit area as I go. Now I'm going to do the broad stroke across the forehead. Again, keeping a dry 4x4 available in case there's any dripping. You can blot it immediately so it will not continue to drip. You can go right into the hairline as you will peel the forehead, coming across the face. Now we'll do the other side of the face. What we should be seeing as our end point is a precipitation of the sal acid crystals and a little bit of a frosting that will occur. Most of this is the sal acid being precipitated on the skin surface, so you will get kind of a very blotchy frosting, not a stark white frosting with deeper peels and with other peeling agents, because we're really not seeing keratocoagulation.
And because this is a lipophilic peel, that's one of the reasons you get some differences regionally. Where you have more oil glands, you'll see a little bit more absorption of the peel. In addition, one of the major advantages of this peel is that you do not have to neutralize it, and you can overlap it.
There's a little fan, which really can keep them cool while they're having the peel. You can have actually the patient hold the fan and direct it where they need it so that they're participating, they're keeping themselves comfortable as they go. Now you can see nicely the precipitation of it, and that really is your end point. When you've got enough on for a good frosting all over, that's really your end point, and then you really need to let it dry. And as has been brought out, it's an excellent acne peel because it is lipid soluble. So this penetrates into pores, into oil glands, and the crystals themselves will stay deposited in the oil glands where you'll see comedones up to a week later start to disappear. So pigmentation and acne, number 1 peel, just like Mary says.
And rosacea.
In my practice. And I think the Theraplex, as opposed to the bottle of 35% sal acid, stings less because of the carrier. So it's more comfortable.
Right, right. And it's just predictable. You don't have it precipitating in the bottle. Because I actually do these myself, because it doesn't take long. And I'll use a scale with the patient of 0, no pain, 10, horrible pain. And the typical Theraplex peel patient, it's about a 3. What's your pain level, sweet?
What is your pain level now?
Like a 1, 2.
Yeah, it ranges between 1 and 3.
And it's very comfortable.
And it lasts for only 3 minutes or less.
Right. And after this is over, I'll put some cool compresses on for maybe about 5 or 10 minutes. I expect a little redness, a little swelling, maybe a little peeling, but it truly is a very light peel.
I usually put the moisturizer on that comes in the kit. Which is very nice.
I give them to take home when they use it.
It's a nice peel for melasma,
It is.
and it's an extraordinarily safe peel on African American skin.
So
Or
that's
Asian
my other
skin.
point. Yeah.
All ethnicities.
But always remember, for
walkout?
pigmentation, this is one part of your program. It does need to be combined with a bleaching agent, a retinoid, and a sunscreen as all part of it.